to talk about the depression screening and assessment tools. This is something that affects about 15 out of every 100 adults over the age of 65. And the first assessment tool that I have up here is the Beck Depression Inventory, second edition, also known as BDI. And it was initially it was designed to measure the severity of previously diagnosed depression, but it's since been validated for use in the geriatric population. It uses a rank response ranging from 0 to 3 to allow the BDI to assess for variations in the severity of depression over time. And some studies have shown that there's a higher non-response rate associated with this BDI for the geriatric population, and that's because of the questions relating to sexual interest. I guess people of age aren't really willing to share that information. The next one that I would like to talk about is the PHQ-9. And this tracks the severity of depression as well as specific symptoms that are improving or not improving with treatment. And this has been proven effective in the geriatric population. It has 9 items that are based directly on the 9 diagnostic criteria for major depressive disorder in the DSM-4. And the next one is the Center of Epidemiologic Studies Depression Scale, also known as CES-D. It's designed to screen the adult community, or well, actually, it's just adult community members. It was originally used for research purposes, but now it also has been validated as an assessment tool for use in other populations, including the elderly. And its responses are really based on frequency of occurrence, which enables the CES to follow the changes in depression over time. And this one is considered useful for the elderly across different racial, ethnic, and economic backgrounds because of its exceptional psychometric properties that it has. And the next one is the Geriatric Depression Scale, also known as GDS. And it's designed specifically for persons aged 65 and older. And unlike the other instruments, there are no somatic components to this GDS because many of the physical manifestations of depression can easily be associated with other simultaneous illnesses in older adults. So this one is not really suitable for assessing depression in individuals with cognitive disorders. It cannot be used to assess the effects of pharmacological therapy in these people. And the next one is the Cornell Scale for Depression and Dementia, also known as CSDD. And this one's really designed to assess depression in patients with dementia. And the unique thing with this one is that the caregiver is involved in obtaining information about their symptoms. Hamilton, also known as HAM-D, and this one was created with the emphasis on psychological aspects of depression across a variety of populations. And the results, a professional is required to really perform a semi-structured type interview and then answer and evaluate the resulting score provided with that tool that they have. It is not really validated for the geriatric population, but I put it in here because it is considered useful in populations with cognitive defects. And this one just has several questions relating to somatic symptoms. And I put in here the actual forms that are related to this. That's the Beck Depression Inventory, I think it's Inventory, and the PHQ-9. The CESD, GS, and the Cornell Scale, Hamilton, D. And then I threw this in at the end because I think this is a really great assessment instrument to use. Some risk factors that you might want to consider with the elderly when you're thinking about using one of these tools is risk factors like having a disability, maybe cognitive impairment or decline, a new medical illness, poor health status, prior depression, loneliness and isolation, a low socioeconomic status, and poor self-perceived health are also things you might want to look at. A sleep disturbance that they're having, and recent bereavement, a loss of a family member, or institutional placement, like getting placed into a nursing home or a rehab, like several of our people do. And that will conclude my presentation on tools you can use to assess the elderly with depression. Thank you.